Managing diabetes isn't just a physical challenge and definitely has emotions that come with it. And when we talk about food and nutrition being a big component of the plan, there are so many emotions that come with nutrition. One of the things I like to do is make sure that when we talk about food, that I'm looking at the whole picture. Does this person identify with emotional eating? Does this person identify with boredom eating, with stress eating? How much of a barrier might that be in someone's journey? Because you really can't separate the psychology from the physiology when it comes to food and nutrition. We need to make sure that we are talking about those, not only upfront at the beginning session, but then as someone is navigating through their journey. I think some of the emotional stuff that can come up for people is things like if a significant person in their life might pass away and they maybe even associated certain foods with them. Those are just examples of things that people might need to be supported through. Sometimes my counseling skills can really work beautifully, and sometimes I need to make sure that we have a whole team of people supporting. So, certainly working with therapists and different mind body experiences. One of my favorite things is actually sharing with people some stress management techniques, because so many of us turn to either food or alcohol at the end of a long day just for stress relief. And so having other tools in our tool belt for stress management, things like a 1 to 2 minute meditation, deep breathing exercises, there's so much that goes into the long journey supporting someone both physically and also emotionally through that journey. Bringing mindfulness and mindful eating into my clients' journeys is actually one of my favorite tools that I've discovered over time. So if you've never had a chance to eat food mindfully, that is something that I have my clients practice. You can do it in a couple of different ways. I've seen people do it with raisins, I've seen people do it with chocolate, but having a piece of food that you savor, and there is a meditation that goes along with it, is just one of the best experiences that I've even ever participated in with food. And I love to share that experience with my clients. So mindful eating is also part of the emotional support of the journey. Many people have never really taken time to eat mindfully, not because it's something that they intentionally wanted to do, but I've had so many clients tell me that they were one of 5 or 6 kids, and if you didn't eat fast, you didn't eat. So taking your time and slowing down and savoring your food is such a beautiful experience and can actually make you realize that I think food psychology says we get the most enjoyment out of food in the first 4 bites. So really taking time to savor a certain food can almost really help to reshape and change our relationship with food and with that food. And that's just one example of things I like to do in my program. Once this client was able to reduce her need for insulin and seeing a significant amount of weight loss, I believe the amount of weight loss she saw was similar to a weight loss surgery. So it was incredible to be able to see somebody come off 200 units of insulin, eventually come off all of her diabetes medications. But we also knew that she needed to be able to keep this weight off to keep her results. One of the things that we did as far as making it sustainable for her, we kept the base meal plan. I still wanted her to certainly eat high quality protein foods for fullness and fruits and vegetables, but we added back in some high quality carbohydrate foods. So where she had been avoiding carbohydrates to minimize those spikes in blood sugars, we added in whole grains, we added in beans, and we added them in specific amounts that made sense for what she wanted to do and how comfortable she felt. And we did a slow introduction of these carbohydrate foods. So ultimately, if I had to put a label on it, I might say that she ended up on a lower carbohydrate version of, say, the Mediterranean eating plan. But really, it was a plan that was balanced, that did contain carbohydrates, but those carbohydrates were very high quality, high fiber carbohydrate foods. We did it slowly so that she didn't see, number one, high blood sugars, and number two, a lot of weight gain. Carbohydrates do help our body hold on to water. So when people do add a little bit of carbohydrate back into their eating plan, sometimes they see a little bit of water weight gain. And that's, again, my job to help steer people away from being panicked about that and to say this is normal. But all of these things were critical in a slow reintroduction of carbohydrates and a high quality carbohydrate, high fiber carbohydrate foods. And then, of course, in addition to that, the accountability is important. So it wasn't like We wanted necessarily to see her every 2 weeks like we were in the beginning, but we wanted to have a follow-up plan where she could still check in. And then another key piece for keeping weight off is physical activity. So fortunately, she was very excited about staying at her YMCA or her gym, and we were able to work some resistance training into her plan for sustainability too, so that she could build that muscle mass. Muscle mass is your body's ability to burn calories when you're at rest too. You really want to have as much muscle mass as you possibly can to keep the weight off. Those were the components that helped her have these sustainable results. But it was the first time I saw type 2 diabetes remission in front of my own eyes, and it really changed how I talk to people about diabetes, because prior to that, we said things like, once you get diagnosed with diabetes, you will be on medications for the rest of your life, or you'll have diabetes for the rest of your life. And we got to tell her, you are living diabetes free right now. And we don't know how long people can necessarily stay diabetes free. That's still being researched. But we have some guidelines for how to diagnose diabetes remission that came out in, I believe, 2020 or 2021. So it's very exciting to be able to see these types of results. Looking back at this particular case, I think the key factors that were made her so successful is honestly how frustrated she was. When somebody is at what we like to call tipping points, when you get frustrated enough and your why is super strong, the saying is that you can overcome anyhow. So when you know your why, you can overcome anyhow. And I would say that this particular client absolutely embodied that. She said, I'm done. I'm frustrated. This isn't working. And I want a better solution, and I deserve a better solution. And so I'm going to figure out how to do that. If I'm trying to remember, I think she was in her 70s, and she really wanted to be active. She wanted to live. She wanted to be able to play with her grandkids. She wasn't accepting this way of life with the highs and low blood sugars and not being able to be physically active. She just said, no, this is not how I want to live. And I think when somebody gets frustrated and their why is really strong, that quite contributes to their ability to be successful in a state like this. Obviously, she had a medical team supporting her, and I think she had a lot of support from her significant other too. Prior to me working with this client, I really always phrased that type 2 diabetes was a lifelong condition. And we even talk about obesity as a disease, which I think is a wonderful thing. We should be talking about obesity as a disease, but it might not be that somebody wants to live with the disease for the rest of their life. So if there are solutions, specifically ones that can be done with the power of nutrition and physical activity, if these can help someone not to struggle with a disease for the rest of their life, what it really taught me is that I was able to give people hope. I had spent probably 15 years at that point, sometimes being the first person delivering the news that someone had type 2 diabetes. But being able to see the power of nutrition helped me to tell people, hey, there's hope. I don't want you to be so frustrated. There is hope, and you may be able to put this into remission. I used to talk about when people were diagnosed with diabetes was all the baggage that comes with being diagnosed, often things like stigma, shame, frustration. There was an image that I used to use in education when I talked about the baggage. It was like literally somebody putting luggage into a car. And so the image was like, there's a lot of baggage that comes with diabetes, but also you're in the driver's seat and you get to determine your path. The visual of what that looked like. Literally the bags on them had the words guilt, shame, frustration. And then there's like this tiny bag of hope. And then I like to tell people that the hope bag got bigger. These are different things that people would feel when they got diagnosed. And one of the things that was often not shared with people was that there was hope. Now, I knew there was hope because I knew how to manage type 2 diabetes. I knew that lifestyle played a key role. But when I started to see that lifestyle not only could manage it, but potentially put it into remission, that really made the hope bubble so much bigger. I was inspired that people might not have to have the complications of diabetes. And so the thing that is scary about type 2 diabetes is that you can have heart disease, you can have amputations, you can have damage to the eyes. Having people not be as at risk for some of these health problems that would get in their way of living a high quality life really was so powerful to me. And I knew it would be life-changing. As soon as I saw somebody put type 2 diabetes in remission, this is life-changing. And I was so excited to be able to share it with more people.